Ureteroscopy is a surgical procedure in which a small instrument called a ureteroscope is inserted into the urethra, through the bladder, and into the ureter, the tube that connects the kidney to the bladder. The kidney stone is then broken up with a laser fiber into dust-sized particles, which will pass through the urinary tract, or into small pieces, which are removed with a basket. Ureteroscopy is an outpatient surgery, and you will go home the same day. For this procedure, you'll have general anesthesia, which means you will be asleep during the surgery. This procedure usually requires a stent. A stent is a soft, hollow tube about 10 to 12 inches long and made of a flexible plastic material. The stent is placed in the ureter to hold it open. The stent is usually removed within 1 week after the ureteroscopy with a brief in-office procedure. For many patients, a stent can cause irritation of the bladder and ureter, which can cause these symptoms: cramping, discomfort and back pain when you urinate, blood in the urine, frequent urination, urinary urgency, and bladder pain. These symptoms can be managed with medication. The benefit of ureteroscopy is that there is no incision, and it can be used to treat kidney stones that won't break with shockwave lithotripsy. The success rate of this therapy depends on several factors, including the size and hardness of the stone and the patient's body type. Your doctor can provide you with your likelihood of success with this treatment. These are the risks of ureteroscopy. You may need a second procedure in order to remove all of the stones. There is a 1 in 1,000 or 0.1% risk of injury to the ureter that may require surgery to repair. There is a 1 in 100 or 1% risk of a minor injury that may require a stent for 2 to 3 weeks. And there is a small risk of sepsis, which is a serious infection. You can usually return to your normal activities 1 to 2 weeks.
Your doctor has recommended to insert a stent between your kidney and your bladder. The medical term for this is a double J stent. The stent allows drainage of urine from the kidney into the bladder by temporarily relieving any blockage caused by a stone in the ureter or an internal swelling outside of the ureter. The renal pelvis is the area where the kidney attaches to one of the ureters. Urine flows from the kidney through the ureters into the bladder. When emptying your bladder, the urethra transports the urine from the bladder to the outside of the body. This animation shows a blockage in the ureter caused by a stone. Urine is unable to flow from the kidney to the bladder, causing congestion and sometimes pain. The procedure is usually done under general anesthesia. A tube with a tiny optic camera is inserted through the urethra into your bladder. The bladder is inspected and the ureteric opening is located. A contrast study may be performed to assess the urinary tract and to locate the obstruction. X-ray images can now clearly outline the ureter and the obstruction. A so-called guide wire is introduced through the camera into the kidney. The double J stent is inserted over this guide wire. J-shaped curls are present at both ends of the stent to hold the tube in place. X-ray is used to check that both ends are in place in the kidney and the bladder. The stent is later on removed or is sometimes used as a temporary intervention before the removal of the stone with another procedure. You will be discharged from the hospital when you have been able to empty your bladder sufficiently and you have no fever or other complaints.